Hello, everyone. Welcome back to another episode of the MSNS podcast. I am your host, Ryan Lim. I am a current junior one, and here with me is a very special guest, Josiah Loh. He graduated in 2014 and is a current ER nurse. So, welcome, Josiah.
Thank you.
So when you were telling me your story earlier, I was very curious because obviously I think ER is such a popular choice for a nursing field. And, when you're telling me that, hey, you were spending your summers or doing externships, shadowing these doctors in different places, that was really how you found out that you wanted to go into ER. Because at first you were in the OR and you realized that it was a little slower, right?
Yeah, that's correct. Yeah. So starting off, yeah, during the summers and stuff during nursing school, I would volunteer at these doctors' offices. I would shadow in the OR, and it was a great experience. But yeah, the pace was kind of slow. That's just kind of how it is in the OR, and so I knew that wasn't really for me at that time. The ED has always been a very exciting type of thing, especially during nursing school. Like a lot of people want to go into the emergency. So that was the goal. And so I was able to transition there after working like a year in med surge. I was able to get into the ED and I've been there ever since.
Yeah, and before we talk about maybe like the pros and cons or like the duties of you as an ER nurse, I really want to get into that story of what it took to get there. Because I think all of
Yeah.
us, kind of want to build ourselves up so much in college right now so that we can get that dream job right out of the gate, as a new grad. But
Mhm.
as you were telling me, that's very unlikely as an ER nurse because it takes a lot of experience, especially with the type of risk that you deal with to get a job like that. And even you got lucky, right? You said
Yeah.
that, most ER nurses or most gigs require like at least like what 2 to 3 years of experience before they hire you, but you got on with 1 year. But yeah, even before that, right out of new grad, you said that you did med surg, correct?
That's correct. Yeah. So my first job, I had moved out to Phoenix, Arizona, after the NCLEX getting my license and all that. They were the first place to hire me. So I worked a year out there in med surg. Also worked in the wound care clinic as well while I was out there. And so got a year's experience doing that, and then I was able to transition into the emergency department in Fresno, and I honestly got very lucky to get that spot. Yeah, because usually if you are applying for an emergency department or a critical care unit, that's either emergency or ICU, even PACU sometimes is considered critical care. They would like at least 2 to 3 years experience in at least that setting,
Hmm.
in like an emergency setting or ICU setting. There are new transition programs that some hospitals have that, you're working on a med surg or tele floor there, and they have a transition program into the emergency department or into the ICU. That's more of the traditional way of how it's done,
Hmm.
um, from what I understand. But yeah, I got lucky getting into the ER in Fresno just because they were such a busy hospital that they needed people, and they were
Hmm.
willing to train people that only had a year's experience. So it was a pretty steep learning curve, but
Hmm.
I really enjoyed it. Makes me love the emergency department even more, and I see myself being here for a little bit.
Hmm. But you've lived in the Bay Area, like around the Palo Alto area your whole life, and then you went to USF. How can you kind of talk about that mindset of like trying to find a job in the Bay Area in the California on the West Coast, but then ultimately deciding that, the best thing for me right now, rather than just waiting for something in the Bay Area, is to move out all the way to Phoenix, Arizona? Like can you describe like what that mindset and that process was like?
Yeah. So obviously everybody wants to work here in the Bay Area. It's
Mhm.
like the place for nurses to work. Growing up here, as well, I really wanted to stay here. As your family, as friends are, you just know everything here. And so I definitely tried after graduating to apply everywhere here. I wanted to stay in California, obviously the Bay first, and then I would kind of branch down to SoCal. And it was pretty hard. I would say a good three-quarters of my cohort maybe had to go out of state, a good majority of them, which, yeah, it's just, unfortunately, it's just part of nursing here, because everybody wants to work here in the Bay Area. It's, California has patient to nurse ratios, which is something I found out is pretty unique to only California. The rest of the country, not, I don't think many other states have ratios. So, I yeah, I was applying. I didn't hear anything from any hospitals here in the Bay Area. I had maybe had like one or two interviews, but not much. And so, we started looking further out. One of my buddies got was talking to a recruiter who said, "Yeah, like I can get you and your friends out into the same hospital out in Phoenix, if you guys are willing to do that." And so my mindset was, yeah, I rather go out, move out, go get some work experience, and just kind of get into this field. And then the plan is to move back to the Bay Area after like a year or two.
Mm.
And so yeah, we moved out to Phoenix. I went with one of my buddies. We worked at the same hospital, and like a year on the dot, we made plans to come back. And so we both, well, he got a job back in the East Bay, and that's when I transitioned over to Fresno. So I kind of hopped over to Fresno, got into the ED there, worked there for a bit, and then I got a job back in the Bay Area,
Mhm.
working at the VA in San Francisco, and then now I'm working at Kaiser in Santa Clara.
That sounds like such a big, I guess it's like any time you have to take an opportunity elsewhere outside of California, it's a huge risk. Like, you don't really know the area, you don't really know what it's going to be like around there. But I think it was kind of lucky that you were able to have a buddy with you, right? Because I like
Yeah,
a lot of
totally.
my friends right now, like the same thing is like they can't find a job here or they want to pursue something out of state, but a lot of them are just going at it alone. Like they don't really have anybody else with them, and I can't imagine how it'd be like going into a new environment as your first ever job as a nurse, doing it alone.
Yeah.
Because I imagine how important a support system is to anybody, especially nursing students.
Yeah, definitely. It's I was super thankful I had my friend out there with me. I can't imagine doing it on your own. That's just like another level right there. But yeah, it's kind of like that mindset where you're like, okay, like, we have to do some sacrifices to get to where we want to go. And yeah, I had friends that had to go. I had a friend that went to South Dakota by herself,
Wow.
because she got an ICU position there. And
Mhm.
so she did 2 years out there, and came back, and she got a job at, I think it was John Muir, straight into the ICU there.
Yeah.
So it sucks for that first year or 2 years that you're out there, but getting that experience is super invaluable. Like that puts you on the top of the list when you come back and apply for jobs back here in the Bay Area.
Mhm.
So it's rare for new grads at least to get into like ICU or ED, but there's opportunity for that when you look outside of California and go to look at other states. It sucks if you go by yourself, especially, yeah, as a new grad. This is your first nursing job. There's a lot of like stress that comes with that, and that's totally normal. And I would totally suggest, like, if you do that, then you talk to the nurses that are there, and everyone's super friendly. They'll be willing to help out and like give you tips on how to do this job.
Mhm.
And there's a lot of wisdom out there from the older nurses, so don't be afraid to ask.
And I like that the way you described kind of the sacrifice. Like, I guess what I'm trying to say is that you were trying to make this distinction maybe as a new grad that sometimes you kind of have to sacrifice pay for experience.
Mhm.
And, I think that's really important to point out because I think maybe a lot of people don't really want to go into like a sniff or a med surge job like right out of new grad. They kind of want to just get something really big that they really want to do. But I think what you were saying that sometimes you have to get that experience in med surge as a sniff or something to really get where you want to go. But at the same time, you also said that you learn so much as a med surg. There's nothing wrong with med surg at all. Can you just
Absolutely.
like what did you do in med surg that you felt like prepared you for the ER?
Yeah. Um, Yeah, I would say MedSurg taught me. So when I was in Arizona, they don't have patient ratios, so I was getting up to sometimes seven patients to one, which is like totally crazy.
Yeah.
Like blew my mind. I was like, is this like allowed? Like I didn't think this was legal, but out there there's no ratios. They're like, this is we're at capacity. You need to take care of these people. So it taught me time management and prioritizing. I think that's like the number one skills for nurses is just learning how to prioritize. Who's my sickest patient, what needs to be done now, what can wait, who can wait. And I think that definitely helped me transition into the emergency department. You get in the ED, you have like 3 open beds, and then you get 3 new patients all at once. Two from the ambulance, one from the front, and you got to figure out, who am I going to see first out of those three, and so med surg it was a great building block. It was a great foundation, I would say. I know it gets a lot of bad rep. People are like, I don't want to work med surg. It's super slow. But it was great. You learn. It's not as a stressful environment sometimes compared to ED. There's like a nice kind of flow, I would say, on that unit. Things are scheduled for you. Um, Most of the patients aren't super acute. They're pretty stable. So it allows you to kind of familiarize yourself with nursing. Prioritizing, um, learning about medications, doing certain skills. You're in a setting that's not super chaotic yet as you
Mhm.
move into like a more critical care like ICU or ED. So it was a great foundation for me to start with, which I was pretty thankful for.
And yeah, like from my experience as a sophomore too in the med surg unit, I kind of learned early on that nurses have a lot of autonomy because they have their schedule. They kind of have, like you said, the flow going on. They know when they can like pass their meds, when they're gonna do certain procedures for patients, do vitals, checkups, and all that. But I imagine like they don't like I guess they don't really have to see the doctor as much. But I imagine it's a little different in terms of team dynamics for the ED because you were mentioning to me before that um, everybody's kind of new. Everybody's just got into the ER. None of you, the doctors, the nurses, everybody else on the multidisciplinary team really doesn't know what's going on. So you're all trying to get that information together. And I imagine you guys are working together in a different way compared to on a med surg unit. You can just like talk about how what
Yeah,
that
yeah,
dynamic's
for
like.
sure. Yeah, so yeah, like in the ED, yeah, you get a brand new patient from an ambulance, right? And so you get as an intake, you get report from EMS. Like, hey, we found this guy. They give you the rundown. Doc's in there, and so we hear the story from the patient. We hear the story from the EMS, and then sometimes you even call family or whoever comes in with them to like get a more in-depth picture of what happened, what exactly happened, what time it happened, what was going on when that happened. So it's like a lot of information gathering at first, just because, yeah, like they're brand new. We need to find out, what's causing this chest pain. What were they doing at that time? What were they doing before? How were they were feeling the days before? There's a lot of information we have to get. And so, yeah, everybody's just trying to compile information. We're using that information to dictate the course of treatment and the plan of care that we're going to be doing. So we work very closely with our docs. They're literally like on the computers right next to us. We can walk over and be like, hey, your guy in 36, I need this order and I need this order. And they'll just put it in for you. So the team dynamic is very, very crucial in the emergency department and the communication because, yeah, like we're getting everything. We're trying to stabilize this guy enough that he can be transferred to a floor where he's going to be on a team with like a nurse, and that will have that nurse constantly, watching out for them. So we work closely with our docs. We work closely with RT. We draw our own labs and put our IVs in and everything. We do everything. Um, there. Yeah, the doc just
Hmm.
puts the orders in and we just go. So it's great. It's great teamwork, especially in the ED, just because of the chaos. Sometimes you get overwhelmed, and
Hmm.
so we're lucky here at Kaiser because we get floats in each of our pods. So our ED is split into 4 zones, technically 5 if you want to do it. So we have a pit area, which is our physician and triage. Our triage system is we use the ESI scoring system, which I think is standard now. But we'll work. There's 2 docs in there with 3 nurses,
Hmm.
and they'll do a quick screen. Hey, what are you in here for? We'll check their vitals, make sure it's cool, and then we'll start an IV, draw labs, and they go to the back, and then they'll be under a team. So each nurse in the ER can have it's a 4-to-1 ratio, and then depending on the type of patients, if they're more critical, then you go 3-to-1 or even a 2-to-1 if you have an ICU, or even a 1-to-1 if it's like that. And so you have floats that will float between each pod that will be like, hey, like, what do you need help with? Like, hey, I got a new one in like 37. Can you work that up for me? So they'll just hop in. Like I said, like everything's brand new, right? So
Hmm.
any nurse can help you with anything. Do the ambulance intake. Someone does labs, and we try to do a quick team nursing. Like if someone comes new, there's 3 of us that hop in there. One's getting report from EMS, another one's starting a line, getting labs, another one's getting them on the monitor. So we try to help each other out, speed the process up, and yeah, it's a great team dynamic. Comparing it to the floor when I worked in med surg is, yeah, like med surg you have, hey, you're gonna pass meds at 8 o'clock, then you got to change your dressing at 10. So it's a very nice structured flow. You kind of expect what's going to be happening. You can plan it all out. In the ED, you can be chilling for 15 minutes and all of a sudden you get 2 new patients and you got to start working them all up from the beginning. So um, you rely on your team a lot, I would say.
Hmm. Yeah. And yeah, like I think, yeah, just from my experience as well, like being on that message unit and seeing kind of that structure and that organization, it sounds like that is a good way to start out as a nurse, though, build that foundation, eventually work your
Yes.
way up to the ER. Because,
Mm-hmm.
on the other side, when I was an EMT and I kind of was fortunate enough to shadow an ER in San Mateo, like I got to see a lot of the chaos that runs about, like everything
Yeah,
definitely isn't as structured, but you can tell like it's like chaotic structure. Everybody knows what they're doing.
absolutely.
Everybody knows what the priority is. It's not like everybody's just running around like panicking. Like everybody,
Right.
it's fast, but like everybody knows what to do.
Exactly. And I think it's like a beautiful thing in the ED. It's the controlled chaos is what we
Yeah.
say. It's like everyone's like, oh my God, like shit's hitting the fan. But everyone knows like what they have to do. And like everyone knows how to prioritize and like take care of, their sick patients. And it just helps build a camaraderie in the ED. It's just everybody knows like, hey, like shit's going down and everyone's just gonna pull through and like work hard and like help each other out and get this done,
Mm.
which I think is great. Yeah.
Yeah. But because everything is such like everything's fast paced, you don't know like as much information about the patient. I imagine the risks are very high for things being
Mhm.
good or bad. How was that transition like for you? Like going from med surg when it was a little more slow and structured versus going into the ER just with 1 year of experience, trying to pick everything up really fast. Like what was that like for you?
Yeah. So Fresno was like it's a level 1 trauma center. It was like the biggest hospital in that area, that county. It serviced like 10 counties, I believe. Some crazy
Wow.
number. We saw like
Wow.
maybe like 200 patients for a night. So that's just on nights. And so it was a pretty steep learning curve, to be honest. The pace was so much more fast. The patients were sicker, and there's a lot more to do. In the ER, yeah, you're doing everything. You put the line in. They need a Foley, you're doing the Foley there. They need an NG tube as well, you put the NG tube in. There's a lot of nursing skills that you actually have to do in the ER because they're brand new and they need all these things. You're going to be the one that's doing it. Most of the time on the floor, they usually arrive with the IV in or the Foley in or the NG tube in. And so you don't get to do much of those skills on the floor, but in the ER, like you're usually the ones doing all that if it's being ordered down there. So it was, yeah, it was a steep learning curve. It was quite stressful at the beginning, to be
Hmm.
honest. Yeah, I was like, oh my gosh, like this is crazy. Like you're literally like in that chaos, and you're like, wow, like this is the real deal. But you kind of go back to your basics of prioritizing and time management. It's like, okay, I got my 4 patients. Who's sickest? What do I have to do now? And you take a deep breath and you kind of refocus, and you give yourself a plan. Like, okay, like I'm going to see this patient first. I got to do these orders. And then I'm going to go see this one next. And you kind of just have to slow yourself down in your own mind. Like the chaos is always going to be there. It's always going to be going. It's going to be chaotic. But if you have your team, that's all you're focused on is your 4 patients and what we have to do for them to get them home or to get them to the floor and just to get them comfortable, for wherever they have to go. And so, yeah, you ask for help when you need
Hmm.
it. I think a lot of new grads, and I was guilty of this myself, is yeah, like we're too scared to ask for help. We don't want to come off as like we don't know anything. And to be truthful, it's like, yeah, like we probably don't know. We're fresh out of school. We haven't had any experience, if anything, and yeah, it's a scary situation, but yeah, don't be afraid to ask for help. I asked for help, and I got some great advice from these nurses who have been doing it for like 5, 10, even 20 years. They have accumulated so much experience that they're happy to pass it on. I
Hmm.
think a lot of there's a lot of bad connotations of like older nurses eating the new ones,
Yeah.
and it's not true. A lot of nurses are like super willing to help out a new grad or a nursing student, and just give them tips on like how to do things more
Hmm.
efficiently, what to look out for. Um, yeah, and then I think it's a totally a good thing for new grads and new nurses to be asking help and learning from the older nurses.
Hmm. Yeah, I think I don't know when I kind of view myself in that perspective or point of view. I think I would probably be worried too that no one really, I don't want to come off as someone that's incompetent after I just went through 4 years of nursing school. And I guess maybe the best thing to do honestly is just swallow your pride and just reach out for help, because especially I think it
Yeah,
was important for you as a not just as a new grad but just as someone new to the ER, because I imagine you were under a lot of pressure, because it seems like within all that controlled chaos there is kind of this high expectation, not necessarily perfection but close to perfection, because every like if, especially for critical patients, because
hmm,
you don't want to mess up. But I think as a new grad or just someone new in the ER, that's maybe something that you were just thinking of the whole time, like I really don't want to mess up, but then you were able
yeah,
to, even though you made
totally.
mistakes, you were able to learn from them because you were able to reach out to these older nurses, right?
Yeah, totally. Yeah, yeah, like I guess like swallowing your pride is, yeah, like we're not going to know everything coming out of school. We probably have new ideas, which are great. We learn new things. We have a different viewpoint of how to approach a situation, which is awesome. I'm totally for that, and that definitely helps with nursing care. But yeah, it's at the end of the day, we want what's best for the patient, and we want to keep them safe, and we don't want to do any harm to them. Um, that's the role of the nurse, and to advocate for our patients and to be do what's best for them. And so, yeah, if we happen to not know anything, like we don't know what this new medication we're going to give, we don't know the type of reactions some people have to it, then just like, hey, like ask someone else, like, hey, have you given this med before? How do we give it? Like you can look it up, maybe know some type of information on it before you go ask, like, hey, they want me to give this like blood pressure med. I haven't given it before. And most of the time, another nurse has either not given it either, and they're like, dude, I don't know either. Let me go look up with you, like
Mhm.
how to do this, or we'll go find someone who's done it. There's going to be someone, 1 or 2 or 3 people in your department that has probably given it, and they know what they're doing. So it's a learning experience for you and that other nurse too, so Yeah, I've talked to nurses and they're like, yeah, I haven't given this med before. And they ask me and I'm like, I don't know either.
Hmm.
And then let's go find someone else who's done it. They're like, oh yeah, it's a super easy med. This is what it does. And you learn there. And so now you know, okay, so now you've given this new medication, you know what it does. You know how to administer it. Now you store that into your knowledge bank and you can help someone else next time.
Hmm.
So it's good. I think asking for help is super underrated. I think people should totally ask and like learn, because nursing is, you're constantly learning new
Oh
things
yeah.
every day. Every time you're working, there's something new. And when you learn it, you just add that on, and now you have another skill or more knowledge now that you can use for in the future.
Mhm. And I like how you kind of phrase that, how, you're essentially building each other's confidence up. Because I imagine whether you're a new grad or like still nursing, there's always like kind of that thing in the back of your mind, like being scared of like messing up. Like everybody, I feel like as a
Yeah.
nurse, because there's so much like so many like the risk is always there that we're all scared of messing up. But I like that rather than kind of going at it alone and continuing to be scared of messing up, you were able to reach out, and like the same with the other nurses, they were able to reach out to you and you were able to build each other up with confidence. But
Yeah.
yeah.
Yeah, messing up is it's gonna happen.
Mhm.
You know, it depends on the degree of messing up.
Yeah.
Um, yeah, exactly, right. There's you can mess up like for the small things, and then there's some big ones like, oh, dude, like that's we gotta make sure that doesn't happen again. And that's just how it goes in nursing. Things are gonna happen. You're gonna miss something. You may administer the wrong dose, or whatnot. And yeah, like it sucks. You may have some teaching that is required from management. After they talk to you, they find out what happened. But they understand, like, yeah, there's some mistakes that are going to be made, and you do your best not to make them, but sometimes things happen, and you have to learn from it.
Mhm.
And I think for most people, if they have like a big mess up, that's like ingrained in their mind, and that won't ever happen again, because you're like,
Yeah, that's
I
true.
know what happened. So you got to look at it like, even if you did mess up, hey, this is a learning experience. We're going to learn from this. We're going to make sure it doesn't happen again. And then you can come up with new ways to, like, how to prevent that from happening, and you can share that type of knowledge with everyone else, so it doesn't happen to other nurses on your unit.
Mhm. I The way you're describing everything about the year, I can truly tell you're passionate about it. Like you were right
I
out of
love it.
yeah, right out of USF, you wanted to go in. But I have heard of people that, like they wanted to go into ER, that's all they thought about nursing school. And then once they finally reached it, how many years it took to ER, they found out they didn't like it. Like, and then they transferred
Mhm.
somewhere else. But for you, you're here to stay. I'm curious, like, do you have a specific, maybe like an event or story in the ED that kind of helped you realize like this is truly where I want to be? Like, do you have a story like that at all?
uh Let me think in particular story. I think when I was just doing my externship down there, it was my summer between junior to senior year.
Hmm.
I did my externship at in Fresno, and so that, like, definitely was like my first time getting into the ED and just kind of seeing like how it goes. And I think that hospital itself was just like another level. Like, that was like, so there's different types of emergency departments for people who don't know. There's a trauma centers where you get like your stab wounds, your gunshot victims, like super bad car crashes. Those are the ones like you see on TV, like they're rolling them in and they're like, doing active CPR on them, because they got shot. They get dropped off in the front. Their friends just drop them off. They've been shot in the gun. They just drop them off the hospital, and they just leave. That's a trauma center right there. So there's hospitals that are trauma centers. There are hospitals that are not trauma centers. So like Kaiser in Santa Clara is not a trauma center. It's like a regular ED. You have heart attacks, strokes, bleeds. You can have walk-in traumas. I had a lady that she got ran over by her own car. She was trying to move the trash can from behind it, and it wasn't parked, and it just like pushed her down and rolled over her. And she
Wow.
like walked into the ER like, "Hey, I just got ran over by my car. my ribs hurt, and you're just like, holy crap. Like,
Yeah.
so we like, you rush them in, you make sure like nothing else, like no internal bleeding like that. So I think just working in Fresno, it was like, this is fast paced. You see some crazy stuff. This is where I want to be. Like,
Hmm.
this is very interesting to me, and like I want to work in this type of environment. And so yeah, like compared to the OR where like everything's sterile, everything's like somewhat quiet.
Hmm.
The patient's sedated. They're either or like intubated, and they're in surgery, and it's just like the surgeon doing his work, and like everyone's just kind of like waiting on that or like helping him out with that. It has its own stresses. My sister was an OR nurse, and she'll tell me stories like where it's chaotic and whatnot, but not as chaotic as the emergency department, which I found like, yeah, this is what I like. I like that fast pace. I like that you don't know what you're going to get next. You're on your feet, and you're like constantly thinking, what do we got to do? Um, I don't know. I like all the blood
Hmm.
and gore and stuff don't bother me, and
Yeah.
that's I like wounds, like crazy wounds. I like seeing that stuff and working with that. Um, I think just the fast pace of the ED, the chaos, um, the type of things you see, I think was very appealing to me
Hmm.
as a nursing student, and then now as like a actual nurse. I've been in the ED for, oh gosh, 4 years, for almost 5 years. Yeah. So um, it's something I really enjoy and something I see myself in for a little bit of time.
Yeah, and you mentioned, but is it always like that? Because I know you touched on how like how it's a kind of portrayed in TV shows, how everybody maybe out of high school or even in college, like me myself included, like I like to watch a lot of medical shows, and they portray a lot of the emergency rooms, like,
Yeah.
and sometimes I feel like it's a little glamorized. Like, is it always like that, or are there like you're in your daily schedule, do you feel like it's always like 12 hours straight, just insane chaotic energy, or is there like slow periods? Like, what kind of is like that daily schedule as a
Yeah.
nurse?
So it depends on your hospital, depends on like your area. So I'll compare like Kaiser and Santa Clara to like Fresno down there, which are
Mhm.
like completely different. They're both are very busy, both very big hospitals and emergency departments. Yeah, Fresno was like pretty much every night, like you were like 12 hours, go, go, go. Like it was a huge hospital, super sick patients, like they're going like full speed for 12 hours. You may have like a lull every time period has some type of lull. Like I was working nights in Fresno. So between, I would say, 3 a.m. to 6 a.m., usually you would see a decrease in people coming in just because people are sleeping.
Mhm.
But then when you're starting your shift at like 7 p.m., it's like maxed out. Like you got people in the waiting room. It's like a 3 hour wait, and it's just constant. You're just working, working, working. At Kaiser, I work 11 a.m. to 11:30 p.m. That's usually the swing shift. We're usually busy when you first come in around 12 o'clock. You'll start seeing a rush. In the ED, there's just like kind of waves. Like you can kind of, after you've been working there for a while, there's like a people come in at 12 o'clock, 3 o'clock, and 5 o'clock. For some reason, those are the times where there's usually like an influx of patients.
Mhm.
You can have days where like we're chilling. There's not a lot of people coming in. Um, and you have maybe two patients, and then um, it's pretty nice. You enjoy those days when you
Mhm.
can, and then there's days where it's like you have your four, you discharge one, someone comes and cleans your room for you and puts a new patient in there, and you start over from there. So there's definitely I would say waves, where it's busy, and then where it kind of slows down for you a bit, where you can catch your breath and kind of cool down for a bit. Flu season's coming up, so
Oh yeah.
that's usually when we're like super busy. We'll have like hallway teams. We're just so maxed out. We have no more beds, so they put beds in the hallways, and you have to manage them there, which is always fun. But yeah, it comes in waves. it's not always 12 hours of chaos. It could be. You should be prepared for that if you work in the ED. And that could be your baseline for like a couple months before it kind of slows down. And then you'll get like maybe a day where it's not super busy. You can kind of relax a little bit.
Mhm.
Yeah.
Yeah, and I'm curious, do you think it's like that everywhere, anywhere you go in ER? Like comparing
Yes.
like level one trauma centers. Like, do you think it's similar everywhere, but or was it more? Do you feel like you experienced even more in Fresno because maybe it was a little bit away from the Bay Area and it was in charge of a little more counties? Do you feel like because so many more patients were relying on your specific hospital, do you feel like more of the bad shit came to you because of that? You know?
Yeah, I think so. Yeah, so Fresno is like the main hospital out in that area. So, um, just population wise of like people they're serving, is a lot more than here in Santa Kaiser and Santa Clara. Because here in the Bay Area, we have so many hospitals. Kaiser alone, you have Kaiser Oakland, San Leandro, Santa Clara, San Jose, San Francisco, like just so many hospitals here in the Bay Area that, they're able to spread out the population between all of them. So not everyone's just going to one hospital out there. That was like the main one you would go to. That was the community hospital. That's the county one. So um, it was definitely a lot more busy over there. And then, but Kaiser here in Santa Clara is a big one as well. And so we're pretty busy there as well. So it totally depends on the hospital. I worked at the VA for a bit in San Francisco. That was a 15-bed ED compared to Kaiser, which we have like 40 beds. And then Fresno had like, I think like maybe 60 or 70. It was like a crazy number of beds. So it totally depends on which hospital you're at, where your hospital is at, and what type of patients your hospital takes. Like the VA, they only take veterans, so you have a very small
Mm-hmm.
population, and specific population that you take care of. Um, Kaiser is like, yeah, people with Kaiser insurance go to Kaiser, versus county, who pretty much has to take everybody, which is what Fresno was. And so people without insurance, um, people, if it's a trauma, like that was the closest trauma center, they're going to go right there. So there's a lot of factors that play into like how busy you guys will become.
Mm-hmm.
And so yeah, but I would say majority of most all EDs across the country are probably pretty busy. ER is like where everyone kind of gets dropped off. Like you're at a clinic, they don't know what's wrong with you. They tell you go to the ER. A lot of people come in, they're like, oh yeah, I talked to the vice line nurse and they told me to come here. And so sometimes those things are like really like you shouldn't even need to come to the emergency department. You should have
Mm-hmm.
set up an appointment with your primary care doctor and then you can take care of it there. But ED is you get everybody. You get from people who are not sick at all, don't need to be seen by a doctor yet, to those who are like, you're like, this guy's gonna die if we don't do anything. So it's a big spectrum of what you see and who you see in the emergency department, and yeah, it's pretty busy, I would say, for most places.
And you know, you're describing this, chaotic nature of most ERs, or like if not all ERs. Do you feel like that anybody can be an ER nurse because of that, or do you feel like it kind of takes a certain kind of person to be in this field of nursing for a long time? What do you think?
Yeah. I think if you are able to adapt to situations quickly, you're willing to learn, um, those are going to take you far in the ER. It's just, yeah, there's different type of people, right? There's some different types of personalities and how people think. Um, there's uh, there's always this rivalry between ED and ICU.
Mm-hmm.
Yeah, like I think every nursing student knows that, it's like, oh, ICU is better or no, ED is better. It's very different ball games. If you put me in ICU, I don't know how I would do. Versus, but you have ICU nurses who transition to the ED, and you have ED nurses who transition to ICU. And I think it makes them an even better nurse. I work with some nurses in my emergency department that have been in ICU for like 5, 10 years and they decide to switch over. And like they are a wealth of knowledge. Like I see nurses, I give them that they know a lot of their stuff that sometimes ED nurses don't know, and vice versa. ED nurses know some things IC doesn't know. But I think in the ED, it's, as you know, like we said, it's chaotic. It's fast. You got to be able to think fast. You know, you got to be quick to adapt to whatever situation arises, um, and be willing to work like in a team setting. Because at the end of the day, yeah, you're working with your doc, you're working with other nurses, you're working with RT, radiology, your unit clerks. There's a lot of people you have to work with to get the patient to where they need to go. And I think for people who want to work in the ED is, yeah, you got to have a good baseline of how you know how you work. Like you understand how you think and how your workflow is, and how you can adapt that into working with other nurses, docs, into the flow of the emergency department. Um, so I think most people can work in the ED if you have, yeah, like a good understanding of your own workflow, and then you have a good ability to adapt and work with others, and yeah, like prioritize and all that, which I think, you know, everyone can do. And I think if you're passionate about it, you're gonna make it happen and you'll make
Mhm.
it work. Yeah.
Yeah, and me, like, to the viewers listening, like me and Josiah, like, say, like, talking about this, saying like, if you really are, uh if you want to be, or if you belong in the ER, that's not to say that you should probably have those skills like right away. I imagine, like, though a lot of the skills of like learning, teamwork, fast, the adaptivity is something you kind of acquire as you can you work in ER. Sometimes you might not have it right away, but I think what you said, like at the very beginning when I asked that question, was like your willingness to learn. I feel like if you have that, it sounds like
Yeah.
you can go really far in the ER if you're willing to swallow your pride and just ask questions and just learn.
Absolutely. Yeah, and I think that it's not even in just the ED, it's anywhere in nursing. Just being willing to learn, it'll take you far. Yeah, like you get some great knowledge, great wisdom from older nurses, and even younger nurses, like new nurses that come out have a different way of seeing a certain situation, and like, hey, why don't we try this? And you're like, I didn't even think about that, you know? Like, yeah, like why don't we try that? So everyone's learning, older nurses, newer nurses, you know, everybody's learning, and it's a constant nursing. You're constantly learning every day you're working. You know, there's always something that you don't know, or something you can know better. And I think just having that type of mentality will take you far. And a good work ethic, like you just, you know, get your work done, um, do it as best as you can, and people will see that and like want to help you out and get you further.
And you mentioned these older nurses being like a wealth of knowledge,
Mhm.
and being open to helping you guys out, but and you addressed this earlier with the rumors about like the old nurses eating their young. And you said that, it's not like a lot of the times it's not like that. But I imagine that there are certain nurses that are like that. And
Yeah.
maybe they might be, I could think that some of them would be in the ER. Maybe some of them are kind of jaded or disconnected from
Hmm.
everything because they've seen everything. Have you encountered that? And if so, like how, as a new nurse, can you approach like those type of nurses that are a little bit more hesitant to help and are kind of jaded from everything because they've seen everything, like I said before?
Yeah. Yeah. Yeah, you for sure will run into those types of nurses. And as you work, like you kind of understand where they get their jadedness from. Yeah. So um, for them, I think you just have to show them that you work hard, and that you're trying, you're doing your best, and like you are trying to be a good nurse. I think a lot of them are just turned off to someone who's new, probably doesn't know what they're doing, who appears like slow and incompetent to them. And I think if you show them like, hey, I may be new, but I work hard. I know most of my stuff at least.
Yeah.
And you know, I can hold my own for a bit, you know. But yeah, there's some new things I don't know, and you know, I'm gonna approach you to ask you a question. So um, yeah, it's intimidating approaching those nurses. Usually you find someone who's not as jaded, and they usually will help you out, and you kind of learn the dynamics. But yeah, I've approached some nurses that are, you know, have a reputation of kind of being, you know, not really friendly towards new grads and all that. And sometimes I don't even talk to them in for like nursing stuff. I just, you know, like, hey, like, how you doing? Like, how, you know, how's your family, or like, what did you do this weekend? And you just kind of start from there, just as like a personal relationship, like a coworker to coworker, like just to like know how they're doing. And I feel like that kind of helps them open up a little bit more. It's not all nursing with them. It's like, yeah, like they're a regular person too. You know,
Hmm.
they have a family, or they have a life that they wanted, that they live outside of the emergency department. So I think that that kind of helps breaks the ice when it comes down to like, okay, like now I need some nursing help. You're like the only nurse here that I can ask. So it makes it a little bit easier for that kind of conversation to happen. Um, but yeah, I think just kind of showing them that, hey, like I can I'm pretty confident in myself. I just, you know, need help in this one area. And usually if they say no, I'm busy, then okay, they're
Hmm.
busy. You got to find someone else, right? You got your charge nurse, you have other nurses, and that's just how it is. And maybe one day they'll open up, and then they'll share all that stuff with you. But yeah, don't be afraid of rejection. You're gonna get rejected a lot in life, and you just got to deal with it, and then just move on, and just okay, that's just that. That was that. And we'll just find someone else that can help me, and that's just how it goes. Yeah.
I like how you pointed out kind of the two sides of a nurse, how, you know, even though these veteran nurses are a wealth of knowledge and they know, you know, a lot more because they've experienced a lot more, that, you know, they're not just some medical dictionary that you can go to when you need help. They're also a person. They have their own lives, they have their own
Yeah.
families. And I like that,
Absolutely.
rather than just purely just going them from maybe like a mentor to a mentee relationship, you kind of like, once you start working together, you are coworkers, you're partners, you guys,
Yeah.
you know, can become friends. So I like that, you know, you approach it from that viewpoint as well.
Yeah, totally. And they're like great people. Like they are like, you know, they're usually older nurses, and they, you know, they've lived life, you know, more than a lot longer than we have. And
Mhm.
yeah, like when you come at like just like at a personal level, and just like we're coworkers, and we're just like gonna shoot the shit and just talk about like our weekend, like they're funny people. I've met
Yeah, I
like
can
some of them
imagine.
where you're like, holy crap, like you're hilarious. Like when we're not talking about anything nursing related, and that just helps build the camaraderie in the ED, and like anywhere, like any unit you're in. You know, you get to know them as a person, and um, it just makes great conversation. People are sharing stories. You know, like every nursing student, you know, you have your stories that you get
Oh
from
yeah.
clinicals,
Hmm.
and then as like a nurse, like you just even more stuff now. So people are trading stories. They're like telling, oh yeah, like they had this one guy, this happened, and like you're just trading poop stories, like code brown stories. What's the worst code brown you've been in? And like you have these crazy stories that people are telling you, and that just like builds up the camaraderie. um, Makes people like, yeah, like you're a normal person too, and makes it easier for you to communicate later on, you know, during the job or whatnot. And so I would highly recommend, like, I think a lot of the mindset going in is like, oh, like, hey, we got to be a good nurse. We have to, you know, perform well and all that. And we forget, like, hey, like, we're human too. Our coworkers
Yes.
are human. Um, you know, we're all doing this together. And as a new grad, there's kind of that mentality, like, okay, like, I'm the new one here, and you know, I got to just listen to these guys and what they say. To an extent, yes. Like as a new grad, yeah, you should learn as much as you can. You don't know everything. You know, try to learn from other people, but don't be afraid to like voice up as well. Like, you know, you're a nurse as well, right? You have your license, you have your RN. Um, you're competent in doing your job. So voice out for like something you think is right for the patient, or what you think needs to be done, and don't be afraid. Don't be too timid on that. And I think nurses will respect you for that. You know, if they see you advocating for a patient, um, you know, they'll support you. You know, they want the best for the patient as well. At the end of the day, that's everyone's goal. And so yeah, I think that's something I wish I had a little bit more when I was a new grad, was a little bit more of a voice.
Hmm.
Um, I would say I would bit more on the timid end at the beginning. Yeah, because it's brand new. You're like, I don't want to mess this up. But if you know, like you need to say something, say it. You know, it's at the end of the day, it's for the patient. Yeah.
Hmm. Yeah, but it's scary. Like I'm not even a new grad yet. I'm a junior one, and I can imagine how scary that must be. And I like that you like acknowledge some of that fear, because in my
Yeah.
mind, like I'm not only like I'm scared of making mistakes. I'm scared. I'm a little worried about approaching these nurses that might be a little bit more jaded. But I think
Mhm.
honestly, one of most my biggest concern is not that I'm approaching these jade nurses, is that I'm going to become one of these jade nurses. I'm going to become desensitized
Yeah.
and burn out, especially in the ER, because I feel like an ER nurse has like the highest rate of burnout amongst any other field of nursing, I imagine.
Yeah, it's that, you know, that chaos of just, yeah, constantly working. It's always busy. There's just a lot of stuff going on, and yeah, you have to find that balance. You know, you don't ever it become jaded. It happens. You see so much stuff, you kind of get desensitized to it. And that happens in any unit, not just the ED, anywhere you're at. It's hard. It's hard work. You see death. You see people suffering. You know, people are not happy. You get verbally abused sometimes, even physically abused. There's a lot of stuff that nurses go through that are like heavy stuff, and you know, it's part of our culture as nurses to like just accept all that. That's
Mm,
just you know, like we would take the abuse. You know, we take people yelling at us, calling us names, you know, spitting or hitting. And yeah, like we shouldn't be taking that. I think it's just in our nature, like, hey, you know, they're probably sick, they're not feeling well, that's why they're acting up like this. Like, we'll just carry on, it's fine. But yeah, like you need to find a balance. You know, you talk to your friends, especially your nursing friends or healthcare friends. You know, we're able to divulge more information to them than if we were to talk to like our other friends, like that are grossed out by like us talking about some gross pressure ulcer that you could fit both your hands into because it was so big and deep. Like, there, people are grossed out by that. But like, you're talking to nursing friends, like, oh, that's pretty interesting. Like, what'd you guys do? What was like your plan of treatment? And so you can kind of talk, and it kind of helps alleviate that kind of stress and like things that kind of hold you down. Um, Working, you know, 12 hours, you work maybe 3 days a week, and you get some days off. I like do everything non-healthcare related on my days off. Like you know, I'll go out hiking, um, go play some ball or whatnot, or go watch a movie, go hang out with friends. It's just to get away from that type of environment, let yourself kind of reset, and yeah, like get yourself in a good place before going back in and like doing your job. I think it's that work-life balance is key. I know a lot of people stress that, and I totally am for that as well. It's a hard job. Nursing is a hard job, no matter where you're at, and so got to learn to take care of yourself. Take care of not only your body, like go stretch, go work out, get a massage if you can. I try to get a massage when I can, just because I think of it as like a body maintenance thing. You know, you're lifting, moving heavy patients, you're doing some repetitive motions. Yeah, and as a new grad, like you're young, you don't feel the pain. But you look at some of the older nurses, and you're like, damn, like yeah, they're like barely walking.
mhm,
They have back problems, knee problems. They're wearing like a brace on their knee or something. You're like, dude, like I'm not trying to get to that, you know.
mhm.
So it's, yeah, you gotta think of these things. You gotta take care of your body, and then yeah, take care of your mind. You know, relax when you have your days off. Try to just step away from the nursing aspect and like try to do something you like and enjoy. Because at the end of the day, like you got to take care of yourself as well.
Mhm. Yeah. I like of all the nurses I've talked to, like there is that common theme whenever I bring up the topic of burnout is, that balance between your personal life and your professional life. Because,
Mm-hmm.
I think in nursing school, it's kind of because, especially now where we're at home and we're doing, schoolwork, studying in our bedroom where we're supposed to be like sleeping and just like chilling, it kind of gets blurred together. Like personal life and
Yeah,
professional life gets blurred together. You kind of view nursing as our entire life. It kind of just swallows us whole. But I think it's
absolutely.
good to hear that, once we do graduate and, we kind of have a little bit more independence because you work a couple days, you get a couple days off. It's good to hear that, you know, as important as nursing is in our life, it doesn't have to become our whole life. Because I think the more that nursing consumes you, I think the more you're going to start to hate nursing, I imagine.
Absolutely. Yeah, yeah, totally. Yeah, it's yeah, like nursing school, like that is your world, right? Like
Mhm.
you're in this, you live and breathe nursing. You know, you have your clinicals, you have your classes you have to study for, you have your simulations, you have your skill checkoffs and all that. Like you're constantly thinking about nursing. And that's what school is. Like they try to immerse you into that world that you're trying to, that field that you're trying to get into. But yeah, like once you graduate, you start working. Um, you're there for 12 hours or 8 hours, you know, depending on your shift. And then you, after you finish your shift, like you're back to just being you and like what you want to do. And yeah, it's key. Like you gotta, if you do nursing the entire time, at a certain point you're gonna get sick of it, right? You had too much of something, you're gonna get sick of it. So it's like getting to the point where, okay, you know, I work my 3 days. I give my 100% those 3 days. I love nursing during those 3 days and all that. But then on my days off, like I'm not doing anything nursing related. You know, I want to go hiking. I want to go do my other hobbies. I want to go hang out with friends. I want to go watch this movie. I want to go to the bar, whatever. Like you got to do what you want to do because, and I think, yeah, that makes you, I think, appreciate nursing more. Like when you live your life, at least for me, like you deal with death and all that, and you see people suffering, it makes you appreciate life more. Like, hey, like this young 30 something year old dude just got told he has cancer, right? And you're like, man, like he's only 2 years older than me, you know. I want to, like, yeah, we're gonna help him, like we're at the job, but when I'm off my job, like I want to enjoy life. Like, yeah, I understand, like life is short for some people, and like we should enjoy it and find a good balance, you know,
Mhm.
when we have work and when we don't have work.
And how has your life, maybe specifically your nursing life, how has that changed as a result of the pandemic, like the coronavirus, everything going on? How has your experience in the ER changed because of that? Because I imagine, because you're gonna see like the patients that have been hit the hardest. So what is that like?
Yeah, so when we had this whole pandemic hit, like yeah, the whole flow in the ED changed. We had to change our whole intake process. So we added an additional nurse to our triage area. So we call them the pivot nurse. So they do an initial screen when the patient first comes in. Like, do you have any like cough, shortness of breath, sore throat, fever, like symptoms of COVID. And we would, if they did, we would take them into a different triage room where it's like isolated from the rest of the waiting room and all that. And so we're wearing like our PPE the entire 12 hours. You know, some nurses are wearing their N95s for 12 hours. We're wearing face shields, regular masks. Everyone has to wear a mask inside. Um, when we get like a code, like someone's coding, and we suspect pretty much anybody that's coding, we're going to suspect that they might have COVID. So now we had to train on putting on our pappers,
Mhm.
how to, we can only have, I think initially they were going to say three people, one doc, one nurse, and one tech. um, in like a code room, right? And you're like, how the hell are we supposed to code someone with just three people, right? You have the doc who's giving the orders, you have the nurse who's documenting or pushing meds, and then you have a tech who's either doing like compressions or something. So they bought like the Lucas device. I don't know if you know that. It's like the automated CPR machine.
Oh, I heard. Oh,
So they
yeah.
bought that so that frees up one hand, right? So I think they increase it now to like maybe four or five. I think five max of people who can go in there. So you have maybe like a doc, two nurses or three nurses if you're lucky, and then like a tech. So and then yes, everyone has to get all the protective equipment on before we can even go in. And so we actually on the training, they're like, yeah, like usually when someone codes, like we all run in there and we, start doing our thing. But they're like, no, literally you have to take care of yourself. You got to put on all the protective gear before you go in to start doing compressions on a guy. So you're like, it was totally weird because like they in simulation, like, yeah, this guy's coded, just coded, and it takes us like 5 to like 8 minutes to get all our gear on before we can get in there.
Uh-huh.
So it's definitely changed the flow of things. And coming out, you have to decon correctly. Cross infection is huge. So it's definitely changed the flow, at least for codes, for intaking patients. Um, yeah, like having isolation patients, it's you try to manage them by grouping all the tasks and stuff that you have to do because we have to conserve equipment. We don't have a lot of gowns, we don't have a lot of masks. So if you're going to go into this isolation room, um, you're going to just do everything at once. So you're going to draw your labs, do whatever procedure, like put a Foley in or NG tube in or something, and you're just going to do it all at once and then send it off and then wait till the next round of orders come in for you, and hopefully the patient goes up. So there's a lot of different uh, protocols being made and still being made at this point by upper management and all that, on how to deal with this whole pandemic thing. It's been
Yeah.
crazy. Yeah.
Yeah. Yeah, and as much as I want to think that's gonna go away after a while, like there's a chance that we might be dealing this for a couple of years. And do you think because there was already so much risk in the ER, everything's high stakes, everything's chaotic, but now it's even worse. There's like, the risk is even high. Like it's not only on the patient now; it's for us. You think because of that, there's a increased barrier to entry for people who want to get into ER nursing? Do you think it's even going to be harder now for people to get into that field?
um I don't think so. I think it's always been a risk that's gonna happen to nurses. You know, it's I don't think it'll impact anyone trying to get in. I think it just makes people more aware now, like, hey, like, yeah, if there's another pandemic, this you're going to be on the front line
Yeah.
dealing with this. So I think it's for hospitals, like, no, like we need nurses still. There's always a need for nurses in the ED and all that. People transition out. I don't think it'll impact any hiring processes. I think it's just more for nurses themselves. Like, hey, like if I think about this, like down in the future, like if I had a family and then another pandemic hits, like, am I willing to be working in that type of situation? I had nurses colleagues that are like, yeah, like I have a newborn at home. I don't want to get COVID. And so they had to reevaluate. If I want to stay in the emergency department or if I want to transition somewhere else. So I think it's more of a personal choice and thought process. But I think for working in the ED, I don't think it'll impact any type of hiring process or anything like that.
Okay. And as a closing statement, can you give some of the viewers who are aspiring to be ER nurses, can you give them a little advice on what they can do in USF and maybe some advice on if they're experiencing trouble getting into an ER department because of how hard it is and how competitive it is? Like, can
Yeah.
you give some advice?
Yeah. I would say, yeah, know your stuff. Like, know the things you've learned. I know it sounds kind of cliche, but yeah, like you got to be competent. You have to at least kind of have a general idea of like what to do in certain situations. For if you want to like know about the ER, I don't know, you can see if any hospitals would offer any type of shadowing program. You probably won't be able to do skills. You might if the, whoever you're following is like chill, like a lot of nurses like, hey, you're a nursing student, you want to put an IV in for me. I think just kind of like you were able to shadow into ED in San Mateo. I think that was great. Just kind of seeing an emergency department in action, that will definitely help you, like, yeah, I want to do this type of nursing. I think that'd be great. Um, Read up on certain things that you're not sure about. Yeah, I think for me personally, that externship was phenomenal. I think if you can find that type of program anywhere, in any ED, I think just exposure is the biggest thing.
Hmm.
Um, for like nursing knowledge stuff, like you know your stuff. Like you go to class, you pass all your tests. If you took your NCLEX and you pass it, like you're competent by the state, but I think for ER is like, yeah, like just being adaptable, um, being open to learning new things. You see so many new type of things every day that um, there's a saying in the ED, like we're a jack of all trades but a master of none. You have you see everything, you know about it, but you're not like the guy to like answer all the questions on that,
Hmm.
versus like a CVICU nurse are known for like their knowledge of the cardiovascular system, or neuro ICU, so you, as an ED nurse or someone who wants to work in the ED, it's like, yeah, like try to gain knowledge on every little thing. You don't have to know it as like an expert, but like just kind of have a general idea of, the process of certain illnesses, certain medications, how they affect the patient, or reactions. What are the common things, common medications we use in the emergency department? You can look all that stuff online. Um, yeah, I think ED is the best unit to work in. I'm glad a lot of people want to work in that type of unit, and it's an exciting unit to work on. You see a lot, you do a lot. Coworkers are awesome. Like ED crowd is like we're a pretty chill group.
Hmm.
Like when we're like just like hanging out with each other, like everyone's super funny. It's a good camaraderie, good team, community there. But then they're also like really smart people. Like they know, they're very calm in urgent situations. Like it's, if you ever get to shadow or just work in the ED for a bit, and like you're in a code, just how calm most everyone is in there is
Hmm.
like very, very cool to see. Like everyone knows their role, everyone knows what they have to do, and everyone just, it's like a silent teamwork. Like they hand you the med that you need at that exact time. Like someone's pulling up your meds for you, hand it, like, here you go. And it's just like it's a beautiful flow that happens in the ED, and it's like very, very cool to see, very cool to be part of.
Hmm.
And I hope, like, yeah, like a lot of these new nurses and nursing students get their way in, and hopefully we can work with you guys soon
Yeah.
in
Thank
your
you very
department.
much. Thank you very much, Josiah Loa. I'm sure everybody who's listening has, just heard so much, and hopefully, people who are watching, maybe this is a potential nursing field you go into. Thank you very much.
Yeah. No, no, I'm happy to do this. Love USF, especially MSNS. I was a member when I was in USF, so I'm super happy you're doing this. This is
Hmm.
awesome. I'm glad to help out, and yeah, if anyone has questions, I'd be happy to answer. Through email, I can give you my email or something, and yeah, hopefully we get you guys into the ED,
Yes,
and
sir.
you guys can do that. So yeah,
All right. Thank you very much. Thank you very much. I'm gonna end the recording now.
sure.